ceremony. We're pleased that you're here. I'm Kim Stewart, and I'm pleased to introduce our CEO for Southwest Virginia Community Health Systems, Brian Haynes.
Good morning and welcome. As Kim said, I'm Brian Haynes. I'm the CEO of Southwest Virginia Community Health Systems. And on behalf of Southwest Virginia Community Systems, I want to thank you guys for taking time out of your busy schedules to join us here today for this momentous event in the Tazewell community. This groundbreaking ceremony this morning marks the beginning of construction of our new medical facility, Tazewell Community Health. I want to recognize our distinguished guests this morning, Donald Buchanan, Mayor, Town of Tazewell, Maggie Asbury, Tazewell County Board of Supervisors from the Northern District, Doyle Rasnick, the Chairman of the Tazewell County IPA, Delegate Will Moorfield, District 3 here in Virginia, and United States Congressman Morgan Griffin from the 9th District. So before I go into detail about the new facility, I want to give you a quick background of Southwest Virginia Community Health Systems. We are a community health system for more than 38 years now. And we provide primary medical services in 4 different communities here in Southwest Virginia. These areas are Tazewell, Virginia, Bristol, Virginia, and Tennessee, Meadowview, Virginia, and here in Tazewell. Our services include primary medical care, both adult and pediatric, dental care, behavioral health, substance abuse, and optometry. We also have ancillary services such as lab and x-ray, and we also have telehealth. So being a community health center is a source of great pride of the board and the staff of Southwest Virginia Community Health Systems. Not only do we pride ourselves in the health given to our patients, but we also strive to be vital and part of the communities that we serve. Staff members of Tazewell Community Health live in or around this community, and we have a local advisory board made up of local residents that provide valuable insight and information about the health status and the overall conditions of the greater Tazewell community. And this information provides us insight into our overall governance of the organization. So Tazewell Community Health began operations here in Tazewell in 2006 in May. At this time there were 3 total staff members, a nurse, a medical provider, and a clerical position. Today operations have grown to where we have 12 staff members, and there are 2 medical providers, 3 nurses, behavioral health counselors, behavioral health care manager, behavioral health case manager, medication assistants, outreach and enrollment for enrollment into health insurance, 2 front-end clerical positions, and a site manager. So there's a great need for health services in Tazewell and Tazewell County. Every assessment of the status of health and health care in the Tazewell and Tazewell County shows that we have real challenges in this community. The overall health of residents is consistently among the lowest in the Commonwealth, and we have shortages of almost every type of healthcare provider. So we're breaking ground here today on a new facility that will greatly expand the services we offer in this community. The new facility will increase the size from approximately 3,600 square feet at our current location to 9,700 square feet. We're going to almost double the number of exam rooms that we'll have available. It should accommodate about 20% more patient visits per year, and we'll employ at least 8, but probably 10 more healthcare providers. So this community needs and deserves a modern facility that will provide integrated primary health care to all people. At this new site, we will continue to provide primary medical care, adding much needed pediatric care, and enhancing access to dental, optometry, behavioral health, digital x-ray, and lab services to meet the needs of the community in this community. The Board of Directors and staff of Southwest Virginia Community Health Systems and Tazewell Community Health Services desire this new facility to be a community focal point for a culture of health improvement. We are here to serve and augment the healthcare provided in the community. We currently partner with other healthcare providers such as Carillion and intend to continue these partnerships. This facility is meant to enhance, not replace, any healthcare services being offered in the community. As the healthcare status indicates, there is tremendous need in the Tazewell community, and Tazewell Community Health is taking a step forward to make a difference in the health of this community. We reached out to numerous partners to help make this facility a sustainable reality. The Health Resources Service Administration, or HRSA, has seen the need in this community and provided a $1 million grant to help us get started on the construction of our $3.2 million facility. And the Virginia Healthcare Foundation has issued a challenge to the community. They will make a grant investment of $100,000 in the facility. However, if our community rises to the challenge and we contribute $100,000 to the project, then the Virginia Community Healthcare Foundation will match that $100,000 dollar for dollar. So $100,000 becomes $200,000. So we ask you to join us in improving the health and lives of our friends and neighbors here in Tazewell by showing our partners that the community supports and is invested in the project. We can gain valuable resources to ensure that we sustain this facility and the affordable care it provides well into the future. You'll find pledge cards in your program materials. We value your contributions and help us meet this challenge. So again, thank you for your attendance here today, and as we celebrate the beginning of a new facility here for Tazewell Community Health.
Good morning. What a glorious day in the town of Tazewell. On behalf of the town of Tazewell, we congratulate y'all's outfit, Southwest Community Health, for our groundbreaking a new facility in the town of Tazewell. It's very important for the health care for our community and surrounding area communities to have a place to go. When I was thinking about what to say, he sort of hit on it here, a new beginning. You know, this site surrounding it had a new beginning for the YMCA, a new beginning for the Korean Hospital. But also 1800, this was a new beginning for the town of Tazewell. It was sort of conceived right down here that the town of Tazewell was going to be a town. It's a new beginning. The head of the Clinch River starts here. So having a new beginning, we congratulate y'all. We congratulate the community for their endeavors. And again, on behalf of the town of Tazewell, we welcome y'all. Our hands are open, and if you need anything, just give us a call. Thank you very much.
What a beautiful fall, crisp morning. As I look around the crowd talking to different ones before we got started, I just feel like I'm among kindred spirits this morning. About half of my HR career was spent in healthcare, and it was spent right up on the hill at Carillion, Tazewell Community Hospital. And I can remember many times we would drive by coming back from lunch or going to work or looking out the window and thinking that something needed to be here. Something needed to be down here. So I also sat on the Tazewell County Industrial Development Authority for 4 years, and I remember the day that this group walked in and shared with us their dream. Well, that dream today has become a reality. What the reality does is increase the scope of services, as Brian said, to our communities with dental, pediatric, optometry, radiology services, and many more. What the Industrial Development Authority looks at, among many things, are jobs. This will increase 8 additional healthcare professionals. Southwest Virginia Community Health Systems in Tazewell County is realizing our dream today. I want to say, though, that there are always unsung heroes. Those folks who work behind the scenes to make sure that everything is done, every dot, every I, every T is crossed to make things happen. Maybe this morning they weren't able to be here, some of those people who work behind the scenes. So this morning I want everyone to give a big hand to those people, and when you go back to your offices, the nurses, the doctors, the clerical workers, let's thank them for everything they've done to make this happen. Southwest Community Healthcare, we commend you for your efforts, for your time on this project. And I don't know you all by name, but I know that on behalf of the Tazewell County Board of Supervisors, we sincerely, honestly thank you for choosing Tazewell County for this wonderful new services in Southwest Virginia. Thank you.
It's another great day for healthcare in Tazewell County. I've been a member of the Tazewell County Industrial Development Authority for a number of years. Can you hear me without that? I'll try to speak loud. In the last 5 years, the authority, with the leadership of the Board of Supervisors, have announced a number of programs to boost the medical field in Tazewell County. 4 major initiatives have been employed to cause dramatic increase in residents' health, utilizing the Virginia Coalfield and Energy Coalition, the creation of a Veterans Affairs Clinic right here on the hill, by recruiting Trina Health to work with diabetic patients down in Claypool Hill. It's one of our newer initiatives. And partnering with Virginia Tech faculty to research the cause of cancer from radon in Tazewell County. And by the way, Tazewell County, the radon belt comes right through Tazewell County. And today we're pleased to announce the groundbreaking of Tazewell Community Health, which will provide access to comprehensive quality health care for all residents of our county. Thank you.
I'm here to welcome you on behalf of Tazewell County Community Health Center Advisory Board. We go to meetings and talk to each other and eat good food, but the important thing is we get connection to our corporate office to give them input about our community. And our community has some unique characteristics. We are 1/24 out of 126 out of 134 counties. We're at the bottom of healthcare provision in the state of Virginia. We have served, over the last years that we've been in business, 13,304 patients. 49,500 visits to the facility. That's just a drop in the bucket of what is needed. There are so many unmet healthcare needs in Tazewell County. This facility will increase the reach of the program. It is in danger. It can only survive with funding. And there are only 2 sources of funding because it's a nonprofit. You do get some revenue from the patients through insurance. But that doesn't cover the administrative cost of professionals who provide those services. So we need input from the community in 2 ways. we would like to ask you to consider supporting financially the Tazewell County Community Health Center as we develop it into a perfect facility to provide health care. We reach all people, no distinction at all. So please consider making a contribution. It will help match the grant that we have before us. But there's another important way that you can input, and that is to talk to your legislators, some of whom are here today. Ask them to work to save the funding for the facility. It's at risk today, and we hope that it will survive. I had the undistinguished experience of becoming chair of a statewide area health education center. And as soon as I became chair, the funding was stopped. I had the duty of disbanding the corporation. That was a sad day in my life. But I don't want to see that happen here. I ask you to help. Not only talk to them today, call your representatives, call the administration, write letters, say we need this for our community. We're in need. It is my pleasure and privilege to come before you to welcome the dignitaries that have been introduced, and also to share with you a speaker that we have to come before you. Will Moorfield was one of the youngest elected delegates in Virginia from Tazewell. He has been in public service since 2010. He was born and raised here. He's one of us. And he cares for the community. He works in the community. He knows the community. And we give you thanks for electing him. He has been appointed to several important committees, a few of which I will mention. He has his business involved in technology, in energy. And he's on the Coal and Energy Commission. He's also on the Committee for Counties, Cities, and Towns. That's who we are in Richmond. We're one of those 154 counties. And he's on the committee that deals with that. And finally, he's on the Committee of Militia, Police, and Public Safety. And today, you know the issue of public safety and police issue. It's good to have our representative on that committee. I want you to please welcome Will Moorfield, member of the House of Delegates of the Commonwealth of Virginia.
Good morning.
Good morning.
It's a pleasure to be here. What a great day for Tazewell County. Tazewell is not only near and dear to me because this is my hometown, but it's also near and dear to my family. Like you, Maggie, my mother got her start right up here at Tazewell Community Hospital, and today she is now serving our country as an officer in the United States Air Force. And so when I graduated from college in 2007 from a small state university in Texas, I moved back for one reason. And I moved back because there were so many people who were leaving our area that had few opportunities to come back. I moved back because I wanted to dedicate my life to public service, dedicate my life to improving our region so that we can have our children stay in the area and encourage people to move back to this area. You know, I commend the people who have made the dedication to seeing this project come to fruition. Maggie Asbury, the Tazewell County Board of Supervisors, the Tazewell County Industrial Development Authority. Most of you today are aware of all of the forward-thinking projects that these men and women have been involved with over the past couple of years. Tazewell County is setting a precedent in leading the way. We've dealt with all the challenges of a depressed economy. Most of you are, I'm sure all of you are familiar with what has happened with the coal and the natural gas industry. Over the past 50 years, we made very little effort to diversify our economy, to build the necessary infrastructure that we needed. And so for an organization such as yourself to make the improvement and to better improve the quality of lives from a health care perspective for some of the poorest people in Virginia is a very big task to take on. As you all know, we're not just struggling in Southwest Virginia and in Virginia, but our entire country is struggling. And in just a few minutes, you're going to hear from a man who represents us in the United States Congress, who works extremely hard to fight for us. But unfortunately, there's so much dysfunction at the national level. And we have a United States Senate who are not willing to pass the necessary legislation to help our region. That is the type of dysfunction that we have. And in Virginia, at the state level, the number of challenges that we're faced with every day. Southwest Virginia and Southside Virginia have the highest unemployment rates. We've seen the most population decline. We have the highest poverty rates. And so, from my experience, working with a Republican administration and now working with a Democrat administration, and I'm sure all of you would agree with me, the situation in our region is not getting better. It's getting worse. So last night I was meeting with a group of school superintendents, and they were going over the various issues of what our region is faced with, specifically funding issues. And I made the comment and I said, let's stop having conversations and addressing the problems that we already know we have, and let's start presenting specific solutions to the problems that we have. Because something that we can do in Virginia that Washington can't do right now is we can get things done. What does it hurt to try something that we've never done before? And so these are the things that we have been working desperately on. It's unfortunate, the number of challenges from infrastructure, from roadways, from cell phone coverage, from broadband. It's sad that it's 2017 and we are just now building water infrastructure for some of the poorest areas. And so, is it fair to Southside? Is it fair to Southwest Virginia that Virginia has left them behind? It's not fair. Because it all started right here. The men and women of Southwest Virginia, the coal miners that produced that metallurgical coal, that produced the steel, built this country. And so, we often hear in politics, healthcare is a right. Healthcare is a right. Is healthcare a right? Is food a right? Is electricity a right? Is a new car a right? Is a new home a right? No, but the right to have access to a good paying job, that is a right. So you can earn a good living. So you can put your kids through school. So you can afford to pay for health care. That is the right as Americans that we have. And so I'm asking you, as you go out today, look at the specific solutions. Look individually at what your representatives are trying to do to help our region. Don't go off and base a decision off a soundbite that's good. Because for the past 3,000 years, governments have changed. In many ways, people today are no different than they were 3,000 years ago. We have one group that's promising one thing, and we have another group that's promising another. And so when we have situations where corporations, the wealthy, and the poor are not paying the majority of taxes in this country, the people that are running this country are the men and women that go out and work every single day, the hardworking middle class of this country. And so I ask you, as those that have continue to dwindle, and those that have not continue to grow in population, and we have politicians running for office who can go out and say, we will give you free health care. We're going to give you free subsidies. For the men and women that are working, who can barely afford to pay their electric bill, who can barely afford to pay their health insurance, who can barely afford to feed their family. I ask you, are those the type of people that you're willing to support when they can't provide specific solutions to the problems that we have? And it's not about being a Democrat or Republican. I am so tired of the partisan politics. We have a struggling region, and I can assure you that if we don't band together, things will continue to get worse. And so today, having people like the Tazewell County Board of Supervisors, the Industrial Development Authority, and the men and women with your organization who are making the commitment to start up a business, I commend you. Because it's not easy to be in business today. And it's not easy to be in business today because the government has created the problems that we have. I never thought that I would say this, but just as in healthcare, we have a broken healthcare system. We have to fix this healthcare system. Our government, regulations, our banking sector, we have people representing the banking sector here today, our banking sector is broken. All of this is broken because of government. And so, thank you today for setting the precedent, because if the federal government and the state can't solve our problems, we can solve our problems ourselves, just like we always have. So it's a privilege to be here today, and we look forward to continue working for you for many years to come. Thank you.
I said I wasn't going to say this, but wow, what a nice message. We're really excited to be here. My name's Mike Lee. I'm the chairman of the Board of Directors for Southwest Virginia Community Health Services. We've got several board members here today. I'd like for you guys to just stand up for a second and take a bow, if you would. These are the guys that kind of support what Brian does and his team and make things happen. But the real excitement today isn't a new building. The real excitement today is that we're going to be able to help a lot more people. A lot more people are going to have access to the needs of health care. And I really didn't realize this until a few things that you said. But even more exciting than that is how we took a little bit of help from the federal government, a little bit of help from the state government, and a lot of help from the local government. And we're doing something to change things. And I think that's pretty doggone exciting to be a part of. I have the honor of introducing the next gentleman, and to be perfectly honest with you, I'm very nervous about doing it.
You just say yours won't.
Yeah, I told my wife I was going to say that, and she warned me against it.
It'd be fine.
But Morgan Griffin is the congressman from the 9th District. He works tirelessly, and I was looking at his website just last night. Among the things that he's working on are things to support exactly what we're doing here today. So Morgan, if you will, I appreciate you taking it over.
Thank you very much, and we've heard a lot of great things about the project happening today, and it is important. It's a very important project. I'm going to touch on a couple little things that we've talked about, and then I'm going to talk about health care. I appreciate the radon issue. Who said they were doing a study on radon? Wasn't that? It was over here somewhere. But I appreciate that. I've got a radon eliminator in my house. It's something that affects all of Southwest Virginia. We all need to know the health concerns is the #2 cause of cancer in the country. We know that. Cigarette smoking is #1 lung cancer. #2 is radon. And it's important to know the health aspects and what we can do there. I appreciate that. Will Moorfield does a great job for you all in the state house. They've got to do some experiments and do some things. The Founding Fathers anticipated that each of the various states, commonwealths, etc., would be the hotbed, the testing area for new ideas, and Will's coming up with some new ideas. Whether they work or doesn't, the important thing is that their ideas bubbling up and trying to help the federal government. There's a lot of dysfunction. I would blame about 80% of it on the Senate, but there's dysfunction in the house as well. Just is, I'll tell you about it in just a second. Community health centers are extremely important. I'm very pleased to be here today because we're moving forward and expanding the community health in this area and the community health centers. We know they're important. We're working on it. We have passed a reauthorization bill in the House out of the Energy and Commerce Committee, on which I serve, to reauthorize it, and we paid for it. Good to see you. Just noticed the college president in the audience. Nice to see you. Thank you for being here. The bottom line is that we had a big fight on it. It was a partisan vote on community health centers. Now, not because the Democrats don't support community health centers. They didn't like the way we paid for it. And so it's a battle, and it hasn't come to the floor. If we'd had agreement on how to pay for it, probably would have already been voted on in the House. Would have come out of committee a good 6-8 weeks earlier, and the uncertainties that occur whenever a bill hasn't actually passed would already be laid to rest. But everything that we're doing now seems to take on a partisan tone to it. I think the pay-fors are reasonable. I've got another bill out there that would create savings to the federal government, according to one organization, of $3.4 billion. That would help pay for it as well. That bill's been stymied a little bit because some of the pharmaceutical companies don't like it. I like it just fine. And I'm not going to talk about that in great detail, but I do want you to know that we are moving forward and we're trying to get things done. It's just not as easy as it ought to be. We ought to follow the rules that were set up, that the House of Virginia follows pretty closely to Jefferson's Manual of Parliamentary Practice and Procedure. We claim to do that in the United States House. We don't. And the United States Senate has gone so far off, Jefferson wouldn't recognize the rules they're using at all. But it's important. We also heard mention earlier today of telehealth. And one of the things we're going to be doing here, along with pediatrics, which I think is very important, and the dental work, et cetera, that you all are going to be doing here in this expanded facility with more folks. I think I read a full-time pediatrician, dentist is going to be here. This is all very, very good. But we heard about telehealth, and I'm a big believer in telehealth. It's going to explode, and this is a place where Will's right. The federal government's actually slowing things down. Right now, Medicare doesn't reimburse for a long-distance neurologist someplace else to read a mobile CT scanner. In some circumstances, they're doing some pilot projects. I'm a big believer we ought to be paying for that, because if you can get somebody the help they need quickly and get them the TPA, and about 80% of the strokes are ischemic strokes. I have this bill too. If you get them the TPA quickly, we don't have as many problems with rehabilitation, because the stroke effects never take place. It stops those types of strokes from doing the devastating damage that we've all seen in our lifetimes, at least if you're as old as I am, where people have lost their speech or lost their mobility on one side of their body, and they have to go back in and relearn how to talk and relearn how to walk. Those are traumatic situations, and we have the science available today, and we need the telehealth. And then I'm reminded of one of my favorite stories, and this is where the government's in the way. This little device, and actually it would have been a generation earlier, which is only about 12 months, the way they keep moving these things. Some doctors in Africa are examining the stool of children and photographing with a device they created on their iPhone, photographing the eggs of a parasite. And the device cost them about $9 to rig it up on their iPhone. They sent the pictures back to Boston, and in less than 24 hours knew exactly what type of parasite they were dealing with. A couple years back, I had the FDA in front of the committee I serve on, the health subcommittee, and I'm in there, and we're like, okay, folks, are you going to tell us that duct tape, a small flashlight, a small magnifying glass, and your iPhone has to be approved by the FDA to be used in the United States, because that's what they did in Africa, and they solved a big problem for children? Is it diagnostic? If it's diagnostic, we have to approve it. $100 million is the general cost for somebody to get something approved by the FDA. That's where the government's in the way. And Will's absolutely right. I'm trying to cut through some of that and make it easier, because when it's a new tech, telemedicine item that can bring help to people quickly, particularly in the rural areas, which the entire 9th District is. Even when Roanoke City is not in the 9th District, but even Roanoke City by federal standards is considered fairly rural. That gives you an idea what Tazewell is in the minds of the federal government. But we need to get the FDA out of the way when it's something as simple as duct tape, a flashlight, a magnifying glass, and an iPhone. They don't need to be doing in-depth studies to see whether or not that'll work. You know, and this is the kind of stuff that we have problems with in Washington, D.C. So I told you I'd tell you some of the problems in the House. That's one of them. The fact that we're having a hard time getting community health centers reauthorized because of the fight over how you pay for it is another. Let me tell you what's going on right. We have appropriated the money for groups like HRSA, and that's where the $1 million for this project came from. And I recognize all the hard work, 10 to 12 years to bring this to fruition, all the hard work at the bottom of the pyramid to make this thing rise up out of nothing. But I'm proud to have been a part of the effort to get the capstone on top of the pyramid with all the work at the bottom to bring that $1 million in. And I appreciate the opportunity to do that. I appreciate the opportunity to serve you all. And I thank you for that. Now that being said, let's talk about that $100,000 match, because I'm going to make a little pitch. Will said we can do it all on our own. He's absolutely right. We can do a lot of it. It's good to have that $1 million there. But this extra $100,000, we don't know where the technology is going to go tomorrow. But if you all can raise that extra $100,000 and parlay it into another $100,000, that gives you $200,000 more than what you have on the table right now. You can wire this building with everything that's already anticipated to happen in the next 5 years. And so when we get the FDA out of the way, and when we have telemedicine fully functioning, not just for smaller items, but for all kinds of big things, this facility can be ready to take advantage of the future. You're starting a new beginning today. Thank you for letting me be a part of it. But let's make sure that you anticipate a new beginning 5 years out, when the telemedicine world will have been revolutionized yet again, and they'll be doing all kinds of things that I cannot imagine today, but some of the students at Bluefield can imagine, and some of our scientists and doctors and people that you're all going to hire here can imagine. Let's make it all a reality. Thank you all so much for letting me be a part of this. God bless each and every one of you, and God bless these United States of America. Thank you.
Okay, so everybody smiling at the same time on the count of 3.
Oh.
1, 2, 3. Give your best smile for all of the camera.
Congratulations on this new health care center that's going to be a big asset for the Tazewell community. It's great to be a part of the festivities today, and it's going to be a great facility for the community. Thank you.
It's good to be here. Congratulations on this new facility. We're looking forward to supporting this as much as we possibly can. As we all know, Southwest Virginia is in dire need of new healthcare facilities, and we couldn't be more excited about this project.